Today we will be discussing fall prevention and the strategies we utilize to increase our safety awareness. My name is Amy Etter and I am a Master's of Occupational Therapy student from Rockhurst University. A general overview of the topics we will be discussing includes fall statistics as well as when falls are likely to happen, a variety of home modifications to prevent falls, various technology and assistive devices that may decrease risk of falling, what is the safest way to get up in case you have a fall, what research has to say about falls, and personal factors or consideration for an increased risk of falling. Stroke is one of the leading causes of disability worldwide. Consequences of stroke include physical, cognitive, and psychological impairments, and often falls. Falls are common after stroke, with between 14 and 65% of survivors of stroke experiencing falls while in the hospital, and up to 73% experiencing a fall in the first 6 months after discharge home. In fact, falls are the #1 complication following stroke, and these rates are higher than fall statistics for older adults in general. Other less obvious consequences from a fall include increased fear of falling, which potentially leads to activity restriction, further compounding physical function deficits, and increased caregiver stress. A fall can have a devastating impact on a person. Serious injuries, loss of mobility, reduced confidence, reduced independence, as well as the ability to manage your daily activities. So why is falling so common following a stroke? After a stroke, many survivors may experience having a weaker side, which makes it difficult to balance and may often lead to their knees giving out. Other factors often experienced following a stroke might include dizziness, confusion, and being unaware of one's current level of physical strength, as having a stroke can significantly weaken the human body. Certain strokes can lead to increased dizziness and imbalance and confusion depending on where the lesion is in the brain. The good news is there are a number of things you can do to help prevent falls. Knowing your risk factors and taking a few precautions is a good start. To understand how to prevent falls, it's important to know when they are first likely to happen in our daily routines. Some ways in which falls are likely to happen might include, but are not exclusive to, getting up without assistance, not using the proper techniques when getting up or sitting, not using your assistive devices, or being mobile in an unsafe environment. And according to Flint Rehab, if we aren't active and committed to doing our daily seated exercises and balancing exercises that focus on lower extremity, leg strength, and our core strength, this can also be a contributor to an increased fall event occurring. As many falls occur in the home, it's important to ensure our living space is well lit to avoid hazards. Quite often when we think about lighting, we think about where we have lighting, but we also need to think about the type of lighting we use in our homes. In this slide, I've used some examples of how different lighting can affect how clearly we can see objects in our environment. Sunlight on the left is considered the best lighting. However, over time it can be damaging to our eyes. Incandescent lighting tends to be warm-toned and uses more energy. And as you can see from the photo, the warm tone, although calming, does not emit much light to see detail in your environment. If you look at the fluorescent lighting, it's very bright and dispersed, and you can see throughout the entire room. However, it is not damaging to the eyes, so it is considered the best overall lighting. And then on the far right, we have an example of warm-toned lighting on the top with neutral and cool tone lighting on the bottom. If you look from the top left to top right, then bottom left to bottom right, you see that the room significantly becomes more clear and the definition from ceiling to floor space is easier to see. So again, it's important to consider not only the type of light, but the tone as well. So warm lighting tends to blend objects into the room, while cooler lighting tends to help you see when certain items stop and others begin, such as the rug ending and the wood floor space beginning. Many people avoid having lights on as they feel they don't need them or are trying to keep the cost down with their electricity. Sometimes a person doesn't remember to turn on the lights. Removing the need to turn on the lights is a great way to make sure rooms, stairs, and hallways are always bright enough. A wireless motion sensor light makes it easy and quick to automatically light up dimly lit areas like stairs, long hallways, or bathrooms. This could also be used as a nightlight on a bedside table. Again, specific locations to consider additional lighting are always good to consider hallways, stairs, entrances, as well as the bedside table. Doorways and entrances can become a collection for coat racks, hat racks, assistive devices, and can often have shoes that pile up as well as rugs that have corners that easily peel up. Quite often, these areas are not well lit, so organizing the space and leaving it free of clutter is important to prevent falls. Flat surfaces such as nightstands can become a collecting space for items we often mean to put away and at some point don't. This can be especially important as the nightstand where a lamp and phone for access to lighting and help are needed. If there's a lot of clutter on your nightstand, it may not have room for these items, or at least easy access to them if other items are in the way. Chairs are also a place where magazines and other items may be placed, and if you're needing to sit and rest or steady yourself, you will be unable to safely do so with these items in the way. Oftentimes we spend most of our time in a favorite chair, and it makes sense that we want all of our things conveniently placed near this area. However, our house slippers or house shoes, little tables with knickknacks on it, a nice rug or plant, as well as dishes or a teacup may all lead to clutter and ultimately a fall when getting up and coming and going from this area. So in this slide, try to spot the safety issues. If you need more time, pause the slide. So for number 1, if you say cluttered nightstand, this is correct. There are too many objects and there is no room for more useful items such as a table and a lamp. For number 2, if you guessed objects on the floor, this is correct. Clutter can lead to tripping. Worn carpeting or loose throw rugs also pose a hazard. For number 3, if you said non-accessible phone, you are correct. Without a phone near your bed, getting up or rushing to answer a phone could lead to a fall. And for number 4, if you thought awkward furniture arrangement, this is correct. The chair blocks the doorway, so it prevents access to the doorway and does not offer a safe pathway around the room. Here's an example of how you would present the room for fall prevention safety. For number 1, you're seeing a clean nightstand. It's a neater surface which leaves room for the table lamp and other necessary items such as your phone that can be accessed from the bed. Number 2, a less cluttered floor. Shoes are placed away from the walking areas, secure rugs with double-sided tape, or just remove the rug entirely. For number 3, there is an accessible phone or lifeline device. So making sure your phone is within reach of the bed or lifeline service, the phone could be answered with a push of a button. For number 4, better furniture placement. Removing the chair creates a safer pathway to the door. Looking at the definition of an assistive device, it is any device that is designed, made, or adapted to assist a person to perform a particular task. For example, the images you see on the slide are all examples of an assistive device. Assistive devices are products that help make activities of daily living easier and more safe. Canes and walkers, for example, provide vital support and additional balance for users if their muscle strength declines. Like walking aids, other fall prevention assistive solutions are easily obtained and relatively inexpensive, though some may require professional help and a larger investment. Either way, preventing a fall will almost always be cheaper than dealing with the financial and personal costs of an actual fall, which according to the CDC averages about $30,000 in hospital costs. Safety net assistive technology is also worth considering, especially medical alert systems for times when you have fallen and can't get up. These devices may be either home-based or mobile and activate when the user presses an alert button on a wearable accessory such as a pendant, bracelet, or lanyard. In many systems, when pressed, a signal is emitted and emergency assistance personnel is dispatched to rapidly respond to a person's fall. It's never too early to think about investing in these tools to ensure that we stay safe as we age and also assist in fall prevention following a stroke. In today's technology, such as the Medical Guardian brand, there is also motion sensor technology placed within these alarm systems so they can have immediate access to help, whether you can press a button or not, and access to help whether you can answer your phone or not. And the mobile system also has a GPS component added to it, so it can get help by tracking where you are, and you do not necessarily have to press a button. It will just alert you through your cell phone or watch or device you're wearing if you need assistance when it senses sudden movement. If you are able to answer and say that you're fine, then they will not send help. However, if they cannot reach you, automatically caregivers and emergency personnel will come to your aid. Another strategy to have in place for fall prevention or to have in place if a fall does occur is to ensure that a spare key is easily accessed, from giving it to a loved one, a caregiver, or family members, someone you trust who can help other folks like emergency personnel get into your home to give you help if needed. In this presentation, it's important to consider how to get up safely from a fall. So I've included some of the basic steps that will help you in determining how you can practice with a caregiver or someone you trust to ensure that you can problem solve how you personally would get up from a fall should it occur in your home space. One of the most important steps is to just take a deep breath. You've just experienced a traumatic event. Your heart rate is probably at a very fast rate, so you want to take some deep breaths in and deep breaths out to lower your blood pressure and heart rate. You also want to check to make sure that you are okay, patting down your arms, your head, any vital areas of the body to ensure that there's no serious injury and perhaps you should stay where you're at. For step 3, you would want to use your unaffected side to get yourself into an all-four position. Again, this is something you may need to problem solve through and work through, as you will be able to, in real time, figure out how this might look for you, as everyone's strength and current abilities might look a little bit different from each other's. Once you are on all fours, in step 4, you would crawl over to the nearest piece of sturdy furniture that is something that will not easily tip over, and using your unaffected side, push up to a kneeling position in front of the sturdy furniture. Position your unaffected foot firmly on the floor and push up on your unaffected side and pivot to sit on the furniture. Once again, problem solving with a caregiver or a trained professional who is familiar with safety and transfers and mobility will be your best option to understand what your abilities are and how you can safely get up from a fall should one occur. Having a strategy in place, such as this one, as well as having a spare key and technology, are all great considerations to help decrease anxiety from a fall or fear of a fall, should you be challenged with that currently. In this presentation, I'll discuss the results of 2 research studies. And for the first one, within 12 months post-stroke, the results of the study found that 95 of 348 participants, that's 27%, had experienced recurrent falls. Poor postural control, lack of use of a walking aid in the acute phase are statistically significant determinants associated with recurrent falls within the first year post-stroke. The determinant of using a walking aid appears to be primarily driven by those younger than 80 years. In addition to impaired postural control and lack of use of a walking aid, a fall at the stroke unit is a determinant associated with recurrent falls after discharge within 6 months post-stroke. So if you've experienced a fall in the acute care unit, there is an increased statistically significant increase in the fact that you may experience a fall within the first 6 months post-stroke. So in conclusion, more than 1 in 4 individuals with stroke experience recurrent falls within the first year post-stroke. Impaired postural control, lack of using a walking aid in the acute phase, and fall during hospitalization are determinants associated with recurrent falls during follow-up. The determinants differ somewhat at different ages. In the second study, which was a meta-analysis, they looked at many studies to determine what the most effective interventions might be that would decrease risk of falls. This study met with some challenges, however, as many research studies do not look specifically at decreased fall through intervention, and they all had different definitions or varying definitions of a fall event. There is also the fact to consider that not all falls are reported, even within a research study, as they must be reported by the survivors of stroke themselves if they do not occur in the clinic. One thing this study did find is that significant effects were found through vitamin D supplementation, specifically in female survivors of stroke in an institutional setting. However, it was determined to be found in both genders. So with the vitamin D supplementation, they found a significant decrease in fall rate and percentage of fallers. The likely mechanism for the effectiveness of vitamin D in this at-risk population relates to the role of vitamin D in muscle function. So supplementation with vitamin D, with or without calcium, may contribute to increased muscle strength and also to a decreased risk of falls, either directly or indirectly. The study reported a significant decrease in falls after vitamin D supplementation, also found a significant increase in muscle strength and positive correlations between muscle fiber diameter. Muscle fiber diameter just refers to the fibers within a muscle, which many of them make up one muscle, and so overall muscle size was increased as well. Although low-dose vitamin D supplementation was shown to be effective, no significant effect on falls was found in the study comparing sunlight exposure with a control. Some personal factors to consider that might influence increased fall risk would be medications. So when we think about taking sedatives, antidepressants, over-the-counter medications, and tranquilizers, these can all have an impact on our overall balance and coordination and ability to problem solve through different environments, as well as our awareness. So being aware of all the items in your environment that might be trip hazards might be a little bit difficult if you've taken a sedative yet still need to get up to use the restroom. Some comorbidities that might influence increased risk of fall would be vision problems. So it's important to get our vision checked yearly to ensure that we're getting a proper lens fit as well as frame size to make sure that our glasses can stay on and that we are able to see at our best. When considering our feet, our entire bodies are resting on them, so it's important to keep them strong by exercising our feet, making sure that they are not in pain, and utilizing proper footwear. For instance, open-toed or slip-on shoes that are very worn and might have holes in the soles of them can lead to stepping on something quite painful, increased tears in the skin of the foot. So really just taking care of our feet and using proper footwear. Also consider blood pressure, the many consequences of following a stroke, as well as vitamin D deficiency, as we've already discussed in this presentation, can all be factors that increase our fall risk. When looking at age and gender, it's important to consider that as we age, our bodies heal at a much slower pace. This can lead to increased hospitalization or stay at an inpatient facility, which increases our risk of other conditions such as infection and sepsis, as well as urinary tract infections. So all of these things can have an impact on our overall health, as well as our balance and coordination. Looking at gender, much research points to males having a higher death rate from falls versus women and children, so females and just younger children of both genders. And one theory about why this is that males may have a higher, engage in higher risky behaviors, but also their occupations. So whether that be lifelong jobs that were physically demanding, that has taken its toll on their joints and overall muscles and body health now at their older age, or also just engaging in riskier behavior overall. Again, that is just one theory to consider, but all of these things are personal factors that can overall increase our risk of falls, so it's really important to be proactive and monitor our medications, our blood pressure, our vitamin D levels, getting our eyes checked, and really just using caution and always having a strategy in place. So once again, looking at our summary, today we discussed preventing falls by being proactive. So fall prevention is all about being proactive, looking at the ways you can modify your home. Even though we are in our homes and quite often we let our guard down and we use less caution than we know we should, there are many times we get up without using our assistive devices, we get up too quickly, and it's because we think of our home as our safe place. But we really want to use caution and use our knowledge and skills that we have. Are we using the appropriate techniques? Are we using our assistive devices in the home as we do out in the community? And just consider your overall health again, looking at your blood pressure and taking your medications at the appropriate times. Because again, not taking your medications, using blood pressure for an example, if you're taking it at a different time and it can drop or get really high, that can lead to overall dizziness and significantly increase your risk of falls. And falling can have a huge impact on your ability to be engaged in your daily life. So really be proactive, know your options for technology, and as always, have a plan for when a fall does occur. Thank you for listening to my presentation. And here are my references.